Hi there. So I'm Krista. Hall mentioned I'm the physician assistant in the Rush Clinic. We do get a lot of questions about medical marijuana and CBD, so I'm going to go through a lot of human research that's been done specifically in Huntington's disease, and then also some laws surrounding this topic. The state laws vary, and then obviously federal law it does not prohibit the use of medical marijuana. So first we have to answer the question, what is medical marijuana? Marijuana contains approximately 100 different compounds. Those compounds are called cannabinoids. The most prevalent compound that you probably have all heard of is THC. That's the main cannabinoid in marijuana, and that has the psychoactive properties. So that's what causes the high feeling when you smoke marijuana. The second most common cannabinoid is called cannabidiol, or CBD for short. That's the second most common. It does not have the mind-altering effects, so we don't expect people to get that high feeling. It doesn't have psychoactive properties. It comes in many different forms, including leaves, pills, even sprays, creams, and liquid form. So I alluded to this earlier, but the laws vary by state. You can see that the dark green states actually have medical and legal marijuana and recreational marijuana legalized. Some of the states' recreational laws haven't gone into effect yet. Illinois is one of those. Recreational marijuana isn't legalized yet. It will start in January 1st, 2020, so not very far away. It's important to note, though, the states that don't have either medical or recreational marijuana legalized, including a couple states that share the border with Illinois. So the medical marijuana laws in Illinois, in order to get a card, you have to be a resident of the state. When you apply, and also during the entire duration that you're in the medical marijuana program. Illinois actually has a list of conditions that are approved for medical marijuana cards. The list was last updated in August, and unfortunately Huntington's disease was not on the list. There were some other neurological conditions that were included. You have to have a signed physician certification. You have to be at least 18 years old. You cannot hold a commercial driver's license, probably for obvious reasons. We don't want people driving while using medical marijuana. You also can't be an active duty law enforcement officer, firefighter, or correctional officer. The laws for recreational marijuana, however, are a little bit different. So there is an age difference. You can be 21 in order to buy recreational marijuana in Illinois, and you can buy that in medical dispensaries. Like I mentioned, this is not starting till January, so a few months away. It's also prohibited to smoke in any public place, in any motor vehicle, or near anyone under the age of 21. So even if you're in your household where you are legally allowed to use recreational marijuana, it's still against the law if there are people under 21 in the vicinity. So the FDA does actually regulate THC and CBD products. There's only 3 FDA approved products that contain synthetic THC, and those are Marinol, Syndrose, and Cesamet. These do require a prescription, and they're only FDA approved for very specific conditions. So not just anybody can have access or get a prescription or get approved for these medications. One of the conditions is the anorexia, specifically associated with people that are suffering from AIDS. Another condition is chemotherapy-induced nausea and vomiting. So usually you would have had to try other medications for nausea, and if those fail, then you could get one of these medications. There's only one FDA-approved medication that contains CBD, and that's called Epidiolex. And it also requires a prescription, and it's only approved for very specific types of seizure disorders. All of the THC and CBD products that you see over the counter, online, advertised, those are not regulated by the FDA, and if they are claiming to have therapeutic benefits or have a very specific medical use, they're actually in violation of the law. And the FDA has started to send warning letters. I don't know how much these companies care about just a warning letter, but they some of them are getting those. So what does FDA approval mean? Dr. Shannon did talk a little bit about this, but in order to get a substance or a medication approved by the FDA, it has to be evaluated to specifically what it treats. You have to figure out that it actually works, what the proper dosage is so people don't accidentally overdose or even underdose and they're not getting treated appropriately. Very importantly, you have to figure out how it interacts with other medications. So is this going to interact with a blood pressure medication or a antidepressant medication? And then you have to determine the side effects and any safety concerns. The FDA's role is really just to evaluate the research that the investigators conduct. They don't actually conduct the research themselves. I've also gotten some questions about the right to try bill. The FDA is actually not involved in that, those decisions. The companies that are making investigational drugs can determine whether or not to allow their investigational drug kind of be open for people that are eligible under the Right to Try Act. So the last that I had heard, Roche or Genentech right now is not opening their medication up underneath the Right to Try Act. So THC is medicine. So there actually is some evidence that THC is effective in chronic pain. I mentioned the chemotherapy-induced nausea, seizures, neuropathic pain, which is nerve-related pain, muscle spasticity, that's specifically in multiple sclerosis or MS and cerebral palsy, and then cachexia, which is a wasting disorder or an anorexia associated mostly with HIV/AIDS. It's also likely effective, but it still needs more clinical trials in some eating disorders, glaucoma, insomnia, and anxiety. It's important to note, though, that first-time users of THC actually can have an increase, a spike in anxiety instead of a calming effect. And then I mentioned the CBD product has been found to be effective for seizures, but then also for anxiety. There has been animal research specifically in HD models. So there was a mouse model of HD that was treated with a 1-to-1 ratio of THC and CBD, so a combination of both. And some of the mouse motor symptoms, including like a paw clasping behavior that's thought to represent the dystonia in humans, actually improved. So that was great for that research. But then there were some other motor symptoms that didn't improve, including motor symptoms that are thought to represent the chorea of Huntington's disease. Dr. Hall mentioned a little bit about cells and how cells can die because of the mutated Huntington. So cells that express mutated Huntington were exposed to CBD, and the CBD was found to show a 50 to almost 85% protection against cell death. So very encouraging. Hopefully that's encouraging researchers to look into this more and more. And the investigators thought that it was the antioxidant mechanisms that actually help protect those cells. Now let's go into human research, maybe a little bit more relevant to us here in this room. So the first clinical trial I'm going to talk to you about involved just 15 people. So if you remember what Dr. Shannon said earlier today, we really need larger groups of people to definitively decide if something works or not. But this is a start, so we have a start here. So 15 people with mild to moderate HD participated. They were treated with CBD for 6 weeks. Then they had what's called a washout period for 8 weeks, meaning they didn't get CBD or placebo. So they just had 8 weeks with nothing, and then 6 weeks of placebo. They were treated with 10 milligrams per kilogram daily of oral CBD. It was divided into twice daily, so maybe like breakfast and dinner, twice daily dosing. And unfortunately, the investigators didn't find any improvement in chorea or motor scores. They didn't look at cognitive and behavioral changes, however, but they also didn't have any toxic side effects, so it appeared safe. So this brings up an important question. Could a longer study or a study that had more people in it have produced more positive results? So the second trial is itty bitty, just 3 people, so very small, but still important to learn from these 3 people's experience. They were aged between 30 and 56. They had a disease duration from about 7 to 12 years. And CBD was given to these 3 patients orally at 300 milligrams for the first week. And then they escalated the dose to 600 milligrams for 3 weeks after that. So it was a 4-week study. There was no placebo. And it was found that there was some slight improvement in chorea in the first week, and then even further improvement in the next 3 weeks on the higher doses. The only side effect that the researchers commented on was a mildly low blood pressure. And I know typically we think low blood pressure, that's great. It is for the average person. But if it's too low, you could faint or fall. So we definitely are worried about low blood pressure. Importantly, the laboratory tests and blood work was all normal. And then again, it's just 3 people, so not a lot of data, but still important in the grand scheme of things to look at all data that's available. So there is a THC CBD compound called Sativex, and that was used to treat HD patients. It's not currently available in the United States. It's actually available in about 20 to 25 countries outside of the US, but specifically for muscle spasticity related to multiple sclerosis, MS. It contains a 1-to-1 ratio of THC and CBD. So this is what was used in the mouse model of Huntington's disease. So this particular trial involved 25 participants with HD. They were treated with the Sativex for 12 weeks, so a little bit longer. And they used 12 sprays per day. It was an intranasal spray. Unfortunately, they didn't see any benefits in motor, cognitive, or behavioral symptoms. So the investigators were looking at all 3 areas. And there were also not any improvements in the biomarkers related to Huntington's disease. So there was a placebo control. They compared the patients that got placebo to the patients that got the Sativex, and the functional outcomes were the same. So functionally, the patients did the same whether or not they got the active medication. But again, it appeared safe. So that is important. Although we didn't see improvements in the motor, cognitive, and behavioral, it still did appear safe, that there weren't any severe side effects. The next trial I'm going to talk to you about involved a medication called nabilone. I mentioned it earlier. Its brand name is Cesamet, so it is an FDA-approved medication in the US, but it's only approved for chemotherapy-induced nausea and vomiting. It comes in pill form, and it's a synthetic compound, so it mimics THC. It's not actually pure THC. It's just it mimics it. It was a little bit larger of a study, which is nice, 37 patients. They were symptomatic, so this wasn't pre-symptomatic patients. They were symptomatic. They were treated with the nabilone with either 1 or 2 milligrams, and for 5 weeks, and then for placebo for 5 weeks. And they also had that washout period in between the treatment phases. The most common side effects were drowsiness and forgetfulness. And again, there were no significant improvements in chorea, but nobody had dropped out of the study, so none of the side effects were so severe that people had to stop taking the nabilone. This is just a case report, so it's not a clinical trial. It's just one patient's experience with taking nabilone. This patient was actually outside of the United States and got it prescribed for her. So she's a 43-year-old female. She developed HD when she was 24, and she was living with her husband, but her husband was having a lot of difficulties caring for her due to some personality changes and some impulsive behaviors. So she ended up having to move into a residential care facility. At that time, her physician started her on nabilone 1 milligram daily. And after being on the medication for a little while, her husband and the staff at the residential treatment facility reported that her behaviors got better and her chorea got better. it really helped her quality of life. Her husband was able to take her out and be with her more often because before the behaviors were just so severe, he really wasn't able to take her out of the care facility. It's important, though, to know that no formal measurement tools were made. So we have formal documentation that the chorea actually was less. It's just her husband and the staff's kind of opinion of what they noticed, which is still important. But typically in research, we want things to be a little bit more standardized. So another case report, again, outside of the United States, a patient on nabilone. He was 58. He started developing chorea just 6 years prior. He had a CAG repeat of 42, and he had never been on any treatments for Huntington's disease before this. He was only given a one-time dose of the nabilone at 1.5 milligrams. So he came into clinic, he was evaluated, given a one-time dose of nabilone, and 3 hours later, he was evaluated again. His physician felt that his chorea and motor scores actually worsened after the treatment, and his walking became so impaired that he needed assistance, which he didn't need assistance to walk prior to receiving the nabilone. After about 24 hours, the symptoms were decreased, but they didn't resolve for about 48 hours. So it took a little while to kind of get it out of his system and have him walking and back to his normal self. They did do cognitive testing though, and there was no cognitive difference before and after treatment. So his cognition stayed the same. He didn't have worse memory or other cognitive deficits after being treated with nabilone. But it was a very short study. It wasn't looking at long-term data. It was really just a one-time kind of slice in time picture. There's a couple case reports of HD patients using medical marijuana for other conditions, but they had Huntington's disease. So 2 patients were evaluated. They had been using medical marijuana. They were evaluated while they were using that substance, and then they were asked to stop for 48 hours, and they were evaluated again. Both patients reported less anxiety while using the medical marijuana. But the other results were really mixed. So one patient had less depression, one had more depression when they were using medical marijuana. And then the same thing for the motor and chorea scores. One patient had worse chorea, one had improved chorea. But the cognitive changes, again, the cognitive performance was similar compared to using the medical marijuana and being off of it. So I know this is not a trial in Huntington's disease, but we know there are cognitive changes in Huntington's disease. So I thought I'd include it, and it might be relevant for us. So there was a Sativex trial for patients with dementia. It's a little bit larger, a 40-patient trial. They determined that it was well tolerated, so none of the participants dropped out of the study because they had severe side effects. But they looked at very specific symptoms, and all of the symptoms they looked at did not improve with using the Sativex. So that included agitation, nighttime behavioral disturbances, anxiety, mobility, falls, and mood symptoms. So THC and CBD are not benign substances. They can have side effects. We're still learning some of the side effects, especially the long-term side effects. We don't have a lot of data on that yet. So a few of the side effects that have been reported for CBD use specifically is fatigue, diarrhea, changes in appetite, and then even liver enzyme abnormalities. A few of the side effects for THC, that's the psychoactive component in marijuana, include weakness, behavioral and mood changes, fatigue again, dizziness, intoxication, and then cognitive and memory changes. And then even more importantly is good to remember, we don't know if you are using THC or CBD products, we cannot tell you how they interact with your prescription medication. So we don't know that yet. So it's very important to talk to myself or Dr. Hall or your healthcare provider and let us know if you're using these products. So we're at least aware if something changes in your health and it correlates to your starting medical marijuana or you're starting CBD, we can eliminate that as a cause of your health change. So to go a little bit more into the cognitive and memory possible side effects of THC, there were 20 MS, multiple sclerosis patients that had been using cannabis chronically. So cannabis, that includes the THC portion of medical marijuana. And they were found to have reduced cognitive function and diminished volumes of specific areas of the brain compared to MS patients that had not been using cannabis. And then there was another study that found MS patients that used cannabis were twice as likely to be classified as globally cognitively impaired compared to those MS patients that had not been using cannabis. So again, not totally benign substances. We don't know the long-term effects on cognition and memory. And in Huntington's disease, we already know the disease itself can cause impairments in those domains. And so what does this all mean to us? Why do we care? What does this mean? So the most important thing is really more research is needed. So if you remember all of the trials I talked about, they're very small, less than 40 people. So we really don't have a definitive answer. We need more research. Some of the research, though, even these small trials and case reports, it helps kind of push us in the right direction and hopefully has scientists kind of paying more attention to medical marijuana and CBD use. Cell studies have shown that it can be neuroprotective, but human studies really haven't shown that yet. And I would say right now, the research that we have, it really does not support the widespread use of every Huntington's patient or at-risk youth or pre-symptomatic patient using THC and CBD products. And then again, it's not risk-free. We don't really know all of the side effects, and we don't know the possible drug-to-drug interactions with your prescription medications. The most important thing is to talk to your healthcare provider. So whether that be myself, Dr. Hall, your primary care doctor, if you're interested in using a product like this. I usually ask people, well, what are you interested in using it for? Is there something specific? If you tell me, I just heard it's good for Huntington's disease, I probably wouldn't recommend it at this time, but I'm always willing to have these discussions. All right, thank you.